The numbers from last year tell the story. 468 gun deaths in the city of Chicago, more than any city in the United States of America. 2,939 gun shootings that took place, more than any other city in America, including cities like Los Angeles and New York, dramatically larger populations. Across the United States, 372 mass shootings last year. That means more than 4 people were injured, more than one every single day. Is this a problem? It is a problem that goes to the heart of our democracy and to whether or not America will be a livable nation where people can be safe in their homes and neighborhoods and schools and waiting for a bus. And so today we're talking about aspects of this. I'm glad to come to the KLEO Center because they're getting to the heart of the issue when it comes to gun violence among young people. They are reaching out to young people at Hirsch High School and in the neighborhoods here and offering them a helping hand, a mentor, a place to go, something constructive to do with their lives, and that's an important part of this whole conversation. But there's another aspect of it that I think needs to be addressed and we're going to speak about today, and that is a provision in the federal law which is impossible to explain. But over 20 years ago, a provision was put in the law that prohibits any federal agency from doing any health research on gun violence. You see Dr. Himakowski here. You see her white coat. You know that she works at a hospital, and she can tell you the story better than anybody in the room of why gun violence is a health issue, an issue that ends up many times in the hospital, and she has to face the dramatic outcomes of gun violence. She wrote an extraordinary article about her own experience. It is something I recommend to everyone, and she's going to speak to that today. I believe this: we should invest federal funds in making guns safer, in determining ways that people can own firearms in a safer and more responsible way. I'm not talking about doing away with the Second Amendment. I'm talking about what the Supreme Court said: reasonable regulation of guns, reasonable regulation of safety, gun safety. I'll be working to restore these funds that for 20 years have been cut for research in public health. I think this is an important step forward. I think it's something that's long overdue. The President's initiative I support completely, and we ought to add this to it as an element.